Hi, this is John Pagel, and again, I'm going to discuss some of the newer agents that were presented at the American Society of Hematology meeting in San Diego in December of 2016. And I'm here to give you an update on a very exciting approach to treatment for patients with very, very advanced aggressive lymphomas that was presented at the American Society of Hematology meeting, the ASH meeting, in December 2016 in San Diego, California. This is an approach called chimeric antigen receptor T-cell therapy, or CAR. That's the chimeric antigen receptor, CAR T-cell therapy. This is an approach that has been in development for a few years now and has gained widespread attention in the mainstream media and extensive focus for good reason. An incredibly promising technique that looks quite exciting in some very, very difficult settings. We already know that data is quite impressive of using chimeric antigen receptor T cells in patients with relapsed or refractory acute lymphoblastic leukemia, ALL. And now there were updates on using CAR T-cell therapy at ASH for patients with refractory aggressive lymphomas such as diffuse large B-cell lymphoma. This was presented in a couple of important trials. I will first just remind everybody or help everybody understand what a CAR T-cell is. This is a way to trick the patient's own immune system into targeting the malignant cell. So T cells are obtained from the patient. Those are very, very powerful, active immune system cells. They're taken to the laboratory where they're engineered and introduced to receive a chimeric gene that expresses what we call an antigen or a protein on the surface of the patient's own T cells. This is a protein that will target and is made to target the malignant lymphoma cell, as in this case, with an intracellular component that activates the T cell, and in order to allow the T cell to kill the malignant cell to which it is bound. It's a way to genetically engineer these T cells and trick them into not only recognizing the malignant lymphoma cell, but to activate the T cell and induce the immune system cell to kill the disease. It's an incredibly sophisticated approach and highly, very, very much exciting. There were a few studies presented. I'll just focus on a little bit of it. There were studies presented by Juno Pharmaceuticals in Seattle. I'll focus here on the trial presented by a company in California known as KITE, of course run by academic investigators for the large part. This was a trial known as the Zuma One Trial that explored the use of CAR T cells targeting an antigen on the surface of the diffuse large B-cell lymphoma known as CD19. In this study, patients with refractory disease went on to receive CAR T cells. So they had their T cells isolated from their blood. They were engineered. They were expanded in the laboratory. Patients got a little bit of chemotherapy, and then they had a reinfusion of their genetically engineered T cells, which again are made to target the lymphoma cell. These were very, very difficult patients. There were a total of about 93 patients in the trial. These are people who really had run out of most of their options. They were refractory to therapies and had failed stem cell transplantation as well. The response rates were quite impressive. In fact, the overall response rate was somewhere around 40% of these patients. I'm sorry, that overall response rate was around 70%. The 40% was the number for those achieving a complete remission. Quite impressive in a very, very, very difficult patient population. And those numbers were with 1 month follow-up. If patients were followed longer, where the immune system continued to have activity, the overall response rate was 79%, and those who achieved a complete remission was 52%. And it turns out that it held true and all of the different subgroups of patients, regardless of what their risk might have been. And some dramatic improvements were seen. Dramatic reductions in large burdens of disease where patients were able to get a complete remission. And many of those are ongoing, and we need to follow people for a much longer time. But we're very excited about the use of CAR T cells, not only in acute lymphoblastic leukemias, but in lymphomas. And I've mentioned the data here from KITE and from ASH, looking at diffuse large B-cell lymphoma that's refractory. I encourage you to find out more about CAR T cells, but do know that there are side effects that can happen, and some of them can be life-threatening. This is a new research area. We're still learning how to approach these patients to do our best to avoid adverse events, but it needs to be done in a well-controlled setting, and we're continuing to do very well with patients able to survive and have long-term remissions that may be very, very meaningful considering their histories. I hope you'll find out more about CAR T cells as we move forward. Thank you.